हेलो एवरीवन। आज का पॉडकास्ट बहुत ही स्पेशल होने वाला है क्योंकि आज हमारे साथ एक ऐसी पर्सनैलिटी है जिन्होंने डेंटिस्ट्री को बेसिक से मॉडर्न डेंटिस्ट्री में बदलते हुए देखा है और सर ने उन चीज़ों को अडेप्ट किया और आज सर अपनी नॉलेज को अंडर ग्रेजुएट और पोस्ट ग्रेजुएट स्टूडेंट को बहुत स्प्रेड कर रहे हैं। सर डॉक्टर संजीव सलारिया सर, वेलकम टू द शो।
थैंक यू वेरी मच डॉक्टर फैजान।
सो मैं आपको बता दूं कि सर डीजे डेंटल कॉलेज में हेड ऑफ डिपार्टमेंट है और सर इंडिया के बेस्ट इम्प्लांटोलॉजिस्ट में से एक हैं। सर मेरा आपसे डेंटल इम्प्लांट की रिगार्डिंग कुछ क्वेश्चंस हैं। सर मेरा पहला आपसे क्वेश्चन रहेगा कि सर जब भी हम पेशेंट से डेंटल इम्प्लांट के बारे में बात करते हैं तो पेशेंट को थोड़ा डर सा लगता है, तो सिंपली सर एक डेंटल इम्प्लांट है क्या और सर ये ट्रेडिशनल प्रोसेस से कैसे डिफरेंट है?
सबसे पहले तो डेंटल इम्प्लांट आप कह सकते हो एनी external material that
sir.
has been implanted inside the bone, or you can say in the body,
Yes sir.
is known as implant.
Okay.
It may be an ear implants, you can say.
Yes.
It may be extraction and followed by the replacement by a beam
Yes sir.
of an titanium implants that is like a screw that should be placed inside the bone. It should be, and you can say in orthopedics,
Yes.
the joints replacements are also known as implants.
Okay.
They simply cut the heads of the main bones and transplant the implants
Right.
instead of them, and they're utilizing them. So it may be in the dentistry, you can say anything that is placed below the gums to get an prosthesis,
Yes,
or
sir.
inside the bone to get an prosthesis is known as implant.
Yes sir. सो ये डेंचर्स एंड जो प्रोसेसेस हम जो जनरली क्राउन एफपीडीज वगैरह से कैसे बेहतर है सर इम्प्लांट?
As we can see right here, and this is an tooth supported fixed prosthodontics. That means the one tooth is missing and adjacent tooth required cutting followed by replacement by the. It is similar to a, you can say you are crossing a river by taking two pillars from the adjacent side and maintaining a bridge. But in case of implants, we are not supposed to touch these natural teeth.
Okay, sir.
We are simply directing, placing the implant inside the bone.
सर इम्प्लांट के लिए कौन कौन से पेशेंट सूटेबल हैं? सर पेशेंट हैविंग पार्शियल डेंटलिज्म और कंप्लीट डेंटलिज्म, दे आर सूटेबल फॉर इम्प्लांट्स और नॉट?
Any patient is suitable,
यस सर.
except if they are suffering from some systemic diseases, which patient is not consulting, or you can say they are not taking care of their systemic diseases,
Yes.
and you can say they may be an uncontrolled,
Yes.
and maybe sometimes the patient is not aware.
Okay sir.
So before placing an implant in any patient with partial or complete edentalism, if the systemic health is compatible, every patient is suitable. If the
Yes.
systemic health is not compatible, then
Not
we
suitable.
have to take an advice from the consultant,
Okay sir.
physicians, to control those systemic health, and once it is controlled, then we can proceed for
Okay.
implant therapy.
सर जैसे हम कॉस्ट की बात करें इम्प्लांट की, सर बहुत सारे पेशेंट्स आते हैं कि मुझसे तो इम्प्लांट की 25,000 लिए और आप मेरे फ्रेंड से 40,000 ले रहे हैं। सर वो क्या डिफरेंस है? सर वो पेशेंट को हम कैसे थोड़ा मैनेज करें?
It definitely vary from patient to patient. It's not on one patient is we are charging 25,000
Yes, sir.
and one patient we are charging 40,000.
45,000.
It may be, most of the time it may be because of the type of bone available.
Yes sir.
One thing, when the bone is compatible,
Right.
when the bone is of sufficient thickness and width, when the bone is of sufficient
Yes, sir.
thickness and width and can accommodate any implant
Yes sir.
without doing any additional surgeries,
Yes,
may cost you approximately 25 to 30,000 rupees,
Okay,
including crown structure.
Yes sir.
But sometimes the bone is so thin, either we want to go for expansion of the bone
Yes.
followed by grafting to compensate the size of implant inside that. Suppose it is thin,
Yes.
we want to place an implant inside and we want to expand it,
Yes sir.
and we are supposed to place an implant and restore the area with a graft.
Yes sir.
So the cost will vary.
Very.
Maybe sometimes the sinus areas, the patient may require sinus augmentation.
Okay.
So the cost will increase. So it is not, we are charging indifferently from the different patients because of implant. it is because of the technique and
The condition of the
the
patient.
condition of the patient.
Okay.
Conventional patients with 25 to 30, or maybe some untrained people, they are starting
Yes,
with
sir.
18,000 also, because they start learning
Yes,
and
sir.
said they want to reduce their expenditure to get exposure to the most of the patients.
sir.
So it's very
It's
from
very from condition and sir location पे भी थोड़ा
and it
depend है.
maybe you can say location is one of the factor,
Yes sir.
but the most important factor when you are opting for a best treatment option,
Yes, sir.
you should consult a consultant implantologist
Yes.
having a history of long standing,
Yes sir.
who has performed various surgeries and perform and trained very people. They are more suitable. No doubt this learner can also
Yes.
start doing by practicing or by learning different techniques
Yes,
from
sir.
the experts. And but in initial phases of 40 to 50 cases, you should call a consultant
Yes.
and see what are the changes and what are the precautions we are supposed to take
Yes.
before simply jumping into the implantology.
Yes.
Okay.
सर कुछ पेशेंट्स का डाउट रहता है कि सर आफ्टर इम्प्लांट्स हम क्या क्या केयर रखें, जो मेंटेनेंस फेज है आफ्टर इम्प्लांट उसको सर हम कैसे पेशेंट्स को
It is the most important
Yes.
and highly ignored. Once the patient is undergone implant treatment and once he received the crown,
Yes.
after that the patient may wash off.
Yes sir.
पेशेंट भूल जाता है डेंटिस्ट के पास जाना है तो उसको लगता है कि अभी तो हमने भी
जी सर,
इतना
अभी तो
कोर्स
हम दिखा
हमारा
के आए
पे
हैं
किया है.
patient को.
Ideally, like a normal dentition, we should consult an implantologist at least once in a year.
Yes.
Minimal once in a year. Ideally, it should be, we can say, 6 months,
Yes, sir.
because implant also need maintenance.
Okay sir.
Whatsoever we eat, it will convert it to plaque and then calculus, and that will going to impact the health of implant also, similar to the natural tooth.
Okay sir.
But most of the time, the patient's ignoring because he thinks, oh, I'm chewing the food, it's efficiently working. Why the need to go for a dentist?
Yes.
But ideally, prevention is best way
Yes.
to elongate, or you can say to increase the prognosis of implant therapy.
Yes sir.
So that means we should report to the dentist or implantologist every 6 to 1 year, depending upon case to case, in order to maintain the implant health insurance.
एंड सर ओरल हाइजीन अच्छे से मेंटेन रखें ताकि वो
Definitely.
इम्प्लांट फेलियर के चांसेस उतने कम रहे.
कम हो जाए.
जितना ज़्यादा फूड लॉजमेंट से बचेंगे पेशेंट्स उतना इम्प्लांट अच्छा रहेगा.
Definitely.
तो थैंक यू सो मच सर, आपने इम्प्लांट के बारे में इतना कुछ हमें बताया और आपके साथ गाइडेंस. थैंक यू सो मच सर.
Thank you very much, Dr. Faizan, for giving me the opportunity to discuss a brief about implantology.
थैंक यू सर.
Thank you very much.